Hello, everyone. My name is Cynthia Chung. I go by she, her pronouns. I'm an able bodied, cis, hetero, first generation immigrant from Korea who has lived on the traditional unceded territories of the Algonquin Anishinaabe people, colonially known as Ottawa. I grew up in a primarily white, English speaking middle class neighborhood, and I had the pleasure of completing my practicum with the Climate Resilience Unit at the BC Ministry of Health. I would like to begin with deep gratitude and acknowledge the traditional and unceded territories of the Lekwungen-speaking peoples, including the Songhees, Esquimalt, and Wasanich nations, as well as the territories of the Algonquin Anishinaabe on which I'm presenting from today. I would also like to give a big thanks to Hamey and Heather from the University of Victoria for their guidance, and also like to give a big thanks to Sally, my practicum supervisor, and Anna, Mary, and Rebecca, who make up the rest of the brilliant and lovely Climate Resilience Unit. And last but not least, a huge thank you to my family and friends for their ongoing love and support. I'll now speak upon the links between climate change and health. So climate change affects the health of the planet and its inhabitants due to changes in global temperatures that have cascading effects on the air, land, and water systems. In Canada, the release of greenhouse gases from the oil, transportation, agriculture, and health sector contribute to climate change and lead to a variety of climate hazards. In BC, this can include an increase in extreme heat events, changes in precipitation patterns, which can lead to heat-related illnesses and mental health emergencies. It also puts the land at risk for drought and wildfires that can impact food security, air quality, which can result in malnutrition and respiratory illnesses. Other examples include coastal erosion and rising sea levels and their effects on marine biodiversity, the fishing industry, and infrastructures. Climate change does not affect populations equally and is known as a threat multiplier. It worsens existing disparities, further entrenching them through inequitable access to nutritious food, quality housing, mental health supports, and systematically degrades the socio-ecological determinants of mental, physical, and spiritual health. Climate change challenges the current governmental systems in British Columbia, and policy coordination is critical in government adaptation efforts to ensure equity, social justice, and reconciliation is at the center of climate and health policies. It requires cooperative solutions across the public sector to avoid worsening vulnerabilities to climate change, also known as maladaptation. Unfortunately, there's a gap in implementing a collaborative, whole-of-society approach to climate action. Coordination beyond the health system into other health determining sectors like transportation, agriculture, infrastructure, and education is needed.
It'll be directed.
Collaborative climate action achieves multiple benefits across the social, economic, and environmental sectors towards biodiversity and social equity. Collaboration at the policy level will allow for more impactful climate action through the reduction of greenhouse gas emissions, also known as mitigation, to preparing for and adjusting to the impacts of climate change, also known as adaptation. Mitigation and adaptation measures have associated health benefits. These are known as health co-benefits. Some examples of health co-benefits are the mental and ecological benefits of green spaces, or the health benefit of a high plant, low animal-based diet and a lower carbon footprint. Communicating health co-benefits is a great way to motivate climate action, as it draws a more comprehensive picture and leads to more evidence-informed and socio-economically, ecologically aligned policies. But often these co-benefits are overlooked during the policymaking process due to fragmented sectors and limited continuous engagement opportunities. And this is where my practicum project comes in, with the overarching goal to mainstream climate and health considerations into government policies and decision-making to ensure outcomes are adaptive, resilient, and use a whole-of-society approach. So part of my project was the development of policy tools that focuses on both adapting to the health consequences of climate change, as well as mitigating the emissions of the health sector. So with members from the CRU, the Climate Resilience Unit, and myself, we held semi-structured informal meetings with 5 internal partners, so 2 from climate ministries and 3 from health ministries. And we were just wanting to understand the current landscape and appetite for policy resources in the program areas. The meetings also served to pinpoint facilitators and barriers policy workers are currently facing in bringing health and climate considerations into the work. The information gathered during my practicum project will help the CRU, Climate Resilience Unit, to better understand the needs and interests of the partners to develop policy tools that are practical, straightforward for end users in a variety of program areas, ministries, and professionals. So the next slides will review themes that emerged from these meetings, which included areas of need and opportunities in bringing climate and health considerations into policy work. So the first challenge was a need for knowledge or awareness on the link between climate and health at the level of the public sector workers, and executives. So there's an opportunity to provide partners with more educational materials and resources to clearly connect climate risks and hazards with the determinants of health, the health sector, and health determining sectors. This will assist professionals to dig deeper and expand their climate and health literature. The second challenge was the need for data. So all professionals stated that they're unsure where to find climate and health evidence or research to quickly input it into their work. So there's an opportunity to direct professionals to a variety of distinct First Nation, Inuit, Métis, federal, provincial, regional resources and databases that can be used in the works of diverse policy professionals.
But it still will be.
The third challenge was uncertain responsibility. So all professionals felt they needed clear, uniform direction from executives regarding priorities, divisional roles, and responsibilities to increase opportunity and expectation in bringing climate or health considerations into their work. This is an opportunity to outline how climate and health work is pertinent across all levels and sectors of government, and how population-wide co-benefits can be attained by systematically integrating climate and health considerations into policies and programs. The last challenge was limited resources. There's a need for more time, human resources, and mental capacity to engage with other sectors and juggle multiple lenses. So lens fatigue is present in health policy workers. The professional stated that it can feel very paralyzing and overwhelming to apply multiple lenses to their work in order to reduce harmful outcomes and balance many considerations. So there's an opportunity to highlight that climate and health lens is already part of their current work. The social and environmental justice is already aligned with Indigenous, distinctions-based, and gender-based analysis plus lenses. And then specifically to the policy tool that we were working on during my practicum project, there are a few features that the professionals would have liked included. And this is one, to have clear and concise structure that is accessible and easy to navigate, to include headings and terminology of common but unfamiliar concepts such as what mitigation, adaptation, co-benefits, and social determinants of health mean. The second feature is to have open guiding questions that allow for reflection to prompt out-of-sector thinking and implications for the future. Questions that focus on health and climate impacts, equity, and resilience in a changing climate is highly recommended. The third feature was only spoken upon by the health background professionals, and they wanted relevant, real-time, implementable examples to highlight innovative ways the health sector is achieving climate action. And the last one is a push for continuous connection and collaboration, which was spoken upon just by the climate ministry folk. They would like to be part of a hub or a network that goes beyond this tool. It's interesting to note that ongoing collaboration with other sectors was not mentioned by the health group, even though the health sector would benefit greatly from working with health determining sectors. So this is an area that should be explored further. And it's out of the scope of this tool, but having an avenue for sectors to connect would be key to allowing the sharing of ideas, case studies, resources, and a free flow of information for continuous collaboration and enduring partnerships, especially for the health group. Given the short time period of this practicum, very informal nature of the conversations, limited number of professionals, and minimal inclusion-exclusion criteria, data saturation was not reached for both the challenges and facilitators, and this threatens the validity and generalizability of the results. Therefore, it's recommended to pilot the policy tool prior to launching it across the BC government. So the information gathered during my practicum project will help the Climate Resilience Unit better understand the needs and interests of their partners, which is instrumental to advancing climate and health policy more broadly. I'm hopeful that we will be able to achieve greater collaboration and alignment of climate action for a healthier, sustainable, and resilient future. Thank you.